Beta blockers, although it may seem counterintuitive to administer drugs with negative inotropic activity in heart failure, but they improve systolic function and reverse cardiac remodeling in patients receiving beta blocker. These are especially the one work in remodeling. The benefit is attributed the ability to prevent the changes that occur because of chronic activation of the sympathetic nervous system. Bisoprolol, carvedilol. Carvedilol is a non-selective and it blocks alpha. Bisoprolol and metoprolol are beta 1 selective. Now diuretics. Diuretics reduce signs and symptoms of volume overload such as dyspnea on exertion, orthopnea, peripheral edema. They decrease plasma volume and subsequently decrease venous return to the heart, that is preload. They work on this. The decrease in cardiac workload and oxygen demand. Diuretics will also decrease after load by reducing the plasma volume and thereby decreasing blood pressure. Loop diuretics are the most commonly used in heart failure. These agents used for patients who require extensive diuresis and those with renal insufficiency. Now angiotensin receptor neprilysin inhibitor. You can see here cardiac output is decreased. Now natriuretic peptides go here, and atrial natriuretic and B-type natriuretic, they will release neprilysin, which will cause vasodilation, natriuresis, decrease cardiac remodeling, and it will decrease renin aldosterone. Also, RAS system will be activated, angiotensin 2 to angiotensin 1, and vasodilation, sympathetic activity will be decreased, sodium water retention will be decreased, and cardiac remodeling will be decreased. Now, ARNI, angiotensin receptor neprilysin inhibitor, and ARBs, they will act here to block this, and with this neprilysin inhibitor will act here, block this. This is their beneficial response, and this is the harmful response. Now sacubitril, valsartan. These are the first available angiotensin receptor and neprilysin inhibitor, ARNI. They combine the action of an ARB with neprilysin inhibition and result in the concentration of vasoactive peptides leading to natriuresis, diuresis, vasodilation, and inhibition of fibrosis. Therapeutic uses in patient with reduced ejection fraction who remain symptomatic on optimum dose of beta blocker or ACE inhibitor. Orally administered with or without food. Half-life is approximately 10 hours for both and twice daily dosing. Adverse effects include similar to ACE inhibitor or ARBs. Now hyperpolarization activated cyclic nucleotide gated channel blocker. You can see this is the channel, ion channel. Rate of spontaneous diastolic depolarization is determined by the current through F channels. Sodium intake. Ivabradine inhibits the current. This current is inhibited, you can see here. Spontaneous diastolic depolarization in SA node is determined here. Ivabradine slows the diastolic depolarization. Okay, it slows and lowers the heart rate. This one. Now ivabradine action, it will slow the current in the SA node and reduce the heart rate. Therapeutic uses in HFrEF. Pharmacokinetics should be administered with meals to increase absorption. It undergoes extensive first pass metabolism by cytochrome P450 34A2, an active metabolite. Bradycardia may occur. Is the adverse effects. Now vaso and venodilators. Dilation of venous blood Vessels lead to decrease in cardiac preload by increasing venous capacitance. Nitrates are commonly venous dilators and reduce preload in the patient with chronic HF. Arterial dilators such as hydralazine reduce systemic arteriolar resistance and decrease afterload. If the patient is intolerant to ACE inhibitors or IRBs, or if additional vasodilator response is required, then you will give here a combination of hydralazine and isosorbate dihydrate. Fixed dose of combination these agents will improve in survival in black patients with HF, REF. Headache, dizziness, hypotension are common adverse effects with this combination. Inotropic drugs. Positive inotropic drugs enhance cardiac contractility and increase cardiac output. For this reason, the exception of digoxin is only used for a short period of time, because all of these positive inotropic drugs will increase intracellular calcium and they are associated with reduced survival.